Oral hygiene care and why the mouth matters. The background and problem is that it can be overlooked on a very hectic day. We can forget to do oral hygiene care. And the mouth, it harbors over 600 varieties of microorganisms which colonize on the tooth and the oral mucosa. And the lack of oral care, bacteria can actually migrate into the lungs and it can lead to pneumonia. There is actually an association between oral health and the severity of COVID-19 complications. So factors that decrease the oral hygiene care in the hospital, time, our heavy workload, attitudes, and knowledge or skills of how to do so. Patients could appear that they're independent, and maybe they're not. Oral health, how gingivitis and periodontitis, patients that have that actually could lead to chronic diseases such as lung disease, diabetes, and heart disease, which can increase risk for severe COVID-19 symptoms. Lack of oral hygiene care patients can have difficulty with swallowing, and it can compromise nutritional intake. It can also cause older adults to have swallowing issues. That's high as 68% in a study. It can lead, we said, to gingivitis, periodontitis, which can increase risk for respiratory diseases. It can increase chance for hospital-acquired pneumonia. And it can increase costs, lengthen the patient's stay because of those hospital-acquired pneumonia. More than 80% of all patients who had COVID-19 complications had periodontitis compared to only 43 of those without COVID-19 complications. So what could an unhealthy mouth cause? It could cause dry mouth, ulcers, denture problems, thrush, malnutrition, increased mouth odor, decreased saliva flow, and bleeding in swollen gums. These are some of the patients that we need to look out for that may have risk of aspiration. This is just some of the list. You have stroke, dysphagia, dementia, delirium, malnutrition, decreased level of consciousness. On 3 West, this is a list, or it shows the oral hygiene care products that we have on our floor, minus actually the chapstick, little swab at the very end. This one is basically used for one time only and not to be used again because it can actually collect bacteria. And this is basically used to help moisten up the mouth. So this is how to perform oral care. If we're helping someone, we can reposition to 90 degrees. We can use the Yonker suction tube and swabs. We can use a nice gentle toothbrush, make sure to get the lips, tongue, cheeks, roof of mouth, while we are simultaneously suctioning, removing liquid and loosened up debris. Now we want to do oral health care twice a day, once in the day shift, once in the night shift. Now this is how to properly clean the dentures. Now make sure that you're brush the dentures with a soft bristle with denture cleanser or mild dishwashing liquid. You can rinse the dentures with warm water, never hot. While the dentures are out, you can actually clean the patient's natural teeth, tongue, cheeks. Then you want to soak the dentures overnight in that little container to keep them moist. In the morning, you want to rinse the dentures off. So make sure that you replace the toothbrush every 3 to 4 months. If they have floss, you want to do that at least once a day. Do not share toothbrushes. I guess that's self-explanatory. Basically, you want to store it upright, air dry, eat a balanced diet, limit the sugar. Now remember, when you're providing oral care, make sure to wear gloves, a mask, and an eyewear. Some bleeding is okay unless contraindicated, low platelet count or bleeding risk. Mild bleeding indicates the need for consistent and improved oral care. This slide is about water protocol and the guidelines for that. I actually have a video where Sarah, the supervisor for the speech and language pathologist supervisor, she actually does a great video on what water protocol is. and how it relates to good oral hygiene care, which is the key to water protocol. Oral care assessment, make sure that you are doing this in adequate lighting once a shift. You want to look at the mouth, tongue, cheeks, gums. Note for any redness, bleeding, dryness, secretions. You want to, at this time, obtain an oral health history, and you can develop a care plan. You can find out if they need help with their oral care and get the appropriate supplies. Tips for oral hygiene care. Well, you want to see if they brought their own oral hygiene supplies. You want to educate the importance of oral hygiene, get their health history. Don't be afraid if the gums bleed, and basically be thorough with brushing. Ask patients if they can bring alcohol-free mouthwash, tongue scraper, or floss. Now, this is solutions that may increase documentation. These are just some ideas. Educational programs, teach back of oral hygiene skills using the Ballard suction swab. This is an idea, potentially, if the patient needs help with their oral hygiene care, we can place a little symbol outside the patient's room to indicate that this patient needs our help. Now, together, we can educate our patients on the importance of oral health and teeth cleaning. I love this picture. This was from Christmas a year ago. Thank you so much. And these are the resources.